Sometimes the only thing standing between you and the life-changing diagnosis isn't the right information. It's shame. There's a disease that affects 30 million American men every year. Erectile dysfunction can be embarrassing to talk about. But you might be surprised by some of the things you discover. The solution begins with having a talk with your doctor. I'm Dr. Ozwa, and this is The Balance.
Welcome to another episode of the Erectile Dysfunction Radio Podcast.
Hi, my name's Benjamin, calling in. Obviously, it's uncomfortable to say out loud. You can hear it in my voice. I have erectile dysfunction.
For many people, seeking help is not a masculine thing. My name is Mark Goldberg. I am a licensed clinical marriage and family therapist.
The biggest issue, obviously, is, it's uncomfortable to even verbalize.
My name is Van Vera, and I'm a patient advocate for erectile dysfunction. The reason why a lot of people don't know that people are going through this is because a lot of men don't talk about it.
One of the most painful things of erectile dysfunction is how it can affect a relationship. And when you can't really talk about it with your wife, how can you talk about it with a doctor?
Men have the taboo that this is something that is shameful. They don't want to admit it. My patients, they come to me as a urologist, and we start talking, and I ask them, why are you here? Oh, I get up once a night. They start mentioning problems that are not really a problem. And then when I said, how are the erections? Oh, that's right.
Benjamin, any other past medical history and medical problems?
No, just, I have asthma.
Erectile dysfunction, or ED, could be a manifestation of other problems or issues that could be arising in a man's health. Diabetes, heart disease. And I always tell the patients, if you have two pipes, a big one and a small one, which one clogs first? And they tell me the small one. The arteries in your heart can start clogging too, and you can have a problem.
But one thing that I want to say to you is that there is a solution for your problem no matter which modality it is, and you're going to be back to the old Benjamin.
Benjamin, I just want to commend you for calling in and sharing openly with us. I know how it feels having to speak about this with anyone. I know that because I've gone through this for 10 years. My erectile dysfunction wasn't just about my physical condition. It was about every single aspect of my life, my family, my friends, my relationships. Whenever I would meet someone that I would fall in love with, I would break off that relationship because I didn't want her to find out that I had an erectile dysfunction.
Hello, caller. You are live on the Erectile Dysfunction Radio Podcast.
Erectile dysfunction affects everyone around the person that has this problem. Wives, girlfriends, and partners.
Hi, this is Stephanie. I'm in a long-term relationship. We've been together 6 years. My boyfriend has had some symptoms of erectile dysfunction.
Due to the fact that they have erectile dysfunction, many of these men, they are depressed, they are isolated, and they don't want intimacy. He doesn't want to spend time with me. He doesn't want to go to bed at the same time that I go to bed. And the partner feels like, I haven't done anything wrong. What is going on with him?
And I'm wondering the best way to broach it with him, because when I do, he sort of becomes a different person and goes into a shell.
Has he seen anyone for this problem?
Well, that's the problem. We've talked about it in the moment, but when I have a conversation, say the next day, and I try to bring it up, I expected him to be more open and be let's go to the doctor and solve this. But
there could be something hidden that is causing his erectile dysfunction. One way to find out what it is to, go to a physician so he can explore it.
You guys are really good, I gotta say.
Many men who encounter this believe that they are a 1 in a million case. Actually, millions of men experience erectile dysfunction.
It's people of all ages, of all ethnicities.
One thing that every man should know about erectile dysfunction, there is help out there.
I'm happy to be a catalyst for that, to be an advocate for that.
You are not alone. You are very far from alone.
Ask the question. Your doctor can help you. There is a solution.
Van and Dr. Maria illustrate the importance of asking the right questions. Do not give erectile dysfunction the silent treatment. Push past the embarrassment and have the conversation. I'm Dr. Ozwa, and this has been The Balance. Until next time, be well.